Welcome to Clinical Skills. So this is our intensive care unit within the Clinical Skills unit at RGU. This really provides our students a unique opportunity to practice their acute care skills. So while I've said already we practice a number of skills on each other, when we start looking at invasive techniques that physiotherapists would do, such as suction, it's not a great idea to be practicing that on each other. And therefore we have a variety of mannequins like Metiman here that allow students to explore that acute care work that they're going to need to do when they're out in clinical placement. So to give you an idea of the sort of scenarios that we have here, this Metiman, he's breathing, and I don't know from the video whether you can see his chest is moving up and down. Almost slightly weirdly, he's blinking at the same time. But we can give the students a scenario, so it could be that this gentleman has been involved in a road traffic accident. He's now got a problem with his lungs. We can then show them the information which is here on the screen, which goes through his heart rate, his blood pressure, his temperature, how much oxygen is circulating around his system. We can also make his chest sound as whether he's got extra fluid on his chest or whether he's maybe developing a chest infection. And students therefore have to problem solve what is going wrong with this gentleman, what do you think the cause of those problems are, what are the symptoms that are occurring, and then have to problem solve how they're going to manage that. Again, just like in the ward-based setting, this camera is mounted on the ceiling, which means a member of the teaching staff can be placed remotely just outside at the nursing station and can change these variables. So as the students are discussing what they think is going on, maybe his oxygenation levels may drop, and they'll have to discuss what is happening and why do they think that is happening. As they're carrying out their treatment, the member of staff can make the patient get much better, or they can make them get slightly worse. And again, it gives them that live feedback of potentially whether their treatment has been effective or indeed ineffective. It also allows them to have some acute skills, such as doing suctioning through the mouth, or they can do suctioning through the nose or through a tracheostomy. And again, it's really important that the first time students are using that skill, that they get to use this mannequin, because it is a procedure that needs to be done swiftly and effectively, as you can imagine, with acutely ill patients. So Metiman is used within the acute care modules, which sits within the second year of the programme. And again, students are working here within small group tutorials, so they're having to work as a team effectively to think about how they would manage this patient. And again, it's a supportive environment where we can give them live feedback on how they're doing.